A 23-year-old girl, Destiny Benjamin, has been reported dead 4 days after a hip surgery, popularly known as Brazilian butt lift (BBL), at Synosure Aesthetic Plastic Surgery, Lagos. Various social media platforms have been awash with a viral video of the procedure since her death. Confirming the development, owner of Synosure Aesthetic Plastic Surgery, Dr. Ogbe Omori, denied the allegation that the lady died in a hospital during the surgery. Omori, who spoke to Vanguard, explained that the disease underwent the surgery on March 8th and had complained of difficulty in breathing before she was referred to Genesis Specialist Hospital, Ikeja, Lagos, where she gave up the ghost. When the Lagos Police Command spokesman, Benjamin Hundeyin, was contacted, he said, "To the best of my knowledge, I am not aware of the incident. The family of the deceased have not reported to the police authority." However, effort to get Genesis Specialist Hospital's reaction proved abortive, but the person who answered Vanguard's call at press time said he does not know what happened.
I'm Dr. Ogbeje Omori. I'm a consultant plastic surgeon. The young lady in question, first of all, I want to send my condolences to the family of the young lady who passed away after she was referred from here. She was a 23-year-old girl, and then she had surgery, which was liposuction and fat transfer. After that, she was fine. Her surgery went well, as documented by us. It was there in our case notes. We showed that everything was fine. However, on the fourth day of her surgery, we noted that she had difficulty breathing. And after that, she was stabilized and then having been placed on oxygen and was now referred to a specialist center. An ICU center, which is very close to our facility, within 10 minutes. Unfortunately, surgeries, as you already know, has its own risk. And if you ask any professional doctor or surgeon who knows about liposuction and fat transfer, it's very easy to think that she could have had fat embolism or clot embolism. But when she had difficulty with breathing, a very important investigation was done, and that was an investigation we called CT pulmonary angiogram. A CT pulmonary angiogram is able to detect any clot that is present within the pulmonary system. But unfortunately, she suffered this condition, but it was not any pulmonary embolism. It was not pulmonary embolism. And that made us to begin to wonder what it could have been. Because from the finding of the CT angiogram, a differential diagnosis was raised, having seen that it was not any form of embolism. And the result came out, unfortunately, about 2 days after she did the test. By the way, the test was ordered at the facility where she was referred to. When she got there and they went for the test, the investigation was done, and then this report I'm telling you now, I didn't even get to know about it because it was done at a different facility. However, we maintain a relationship with the facility, and when I was informed and shown the result, it was clear that she didn't have pulmonary embolism. However, it threw up another question of could it be that she had a COVID? Because the features seen on the angiogram were also similar to some of the things seen in COVID lungs. She had 360 liposuction, which is liposuction of the tummy and the back, and the fat was transferred to hip and butt augmentation. Okay, liposuction involves sucking out fat from under the skin. It's a minimally invasive surgery, and then by the time the fat is harvested using some machines that can suck out fat from under the skin, the fat is now processed and injected into any part of the body that needs enhancement or augmentation. It can be used to correct a lot of contour deformities, like any irregularities in the hip area. Some people are naturally born with one hip or butt bigger than the other. So during a hip augmentation or butt augmentation with fat, we are able to correct all of these defects. Before every surgery is done, there are some very basic tests that will have to be done, and they were conducted. And not only that, there are some other special investigations which could also be requested for in some particular instances. For instance, if somebody is hypertensive, you want to do a few more tests to see the quality of the heart. You want to do something like an ECG or an echocardiogram to ascertain the level of fitness. And by the way, a lot of times we are able to do a lot of surgeries with the patients awake. That doesn't mean that we don't do general anesthesia. We do. However, most of the time when we do our surgeries, our patients are awake for most of the time, and that still doesn't mean that they don't have to be investigated. We do all of the basic things that will have to be done, and they were done, and in this case they were all normal. Let me start by saying that in surgery, once an adult can consent for himself or herself before they have surgeries, but they are made to fill a lot of forms, which includes writing out who is their next of kin, who is their family members, and all those things. Yes, she completed all the forms that she had to fill. Yes, it happens precisely on. She was referred on Sunday, which is the 12th day of March, and then by the following morning, we were told that she had passed away. Okay, I want to say that this facility is quite busy. For last year alone, we did over 250 something cases, and then this year, this is March, we've done over 80 cases this year alone. It's quite unfortunate that in this age and time, people can decide to come out and spew out lies, and they'll say it authoritatively as if they knew everything about what has been happening. Now, to answer you directly, this facility has recorded 2 deaths, and those 2 deaths were in 2018 and 2001. Now, let me say that the death that was recorded, for instance, last year, was not related to surgery. In fact, it should have been taken as a criminal case by the police, because the police did a thorough investigation on the lady who passed on, and it was found that, because we have CCTV camera, everywhere you go is fully covered with CCTV. I can put it on record that her friend was seen on camera giving our client a particular drug, and this the police has verified, because she made this confession in the presence of her lawyer, the sister, and some other members of the late girl's family. So the police got to know about this, and the investigation report also confirms that. However, that is not for us to decide why the police has not asked her the motive, the reason for giving her a drug that contained caffeine. The caffeine, as you know, in high dose or in excess dose, which is overdose, can actually cause a heart failure. And that was what this lady suffered. The lady that passed on last year. However, for this year, we have just said that yes, she had surgery. However, it was not, unfortunately, an autopsy hasn't been done. I don't know if the family is going to consent to that. It should have been nice to do an autopsy to see the exact cause of death. Haven't seen now that a CT pulmonary angiogram did not quite confirm that it was due to pulmonary embolism. Embolism can be from fat, which was injected in the case that it is accidentally injected into a vein. By the way, we know where the veins are. We know how to avoid them. We have never had a single case of fat embolism, to the glory of God. Second, we also know embolism can also be as a result of clots. But this lady did not have a clot embolism. So it easily have been shown by the CT pulmonary angiogram. The family have been communicated. We have been in touch with the mother, and yes, we've been in touch with the mother.